Jean Watson's theory of caring. It is such a beautiful theory which I personally love the most because a theory which is going to teach us what are all the various elements that is needed if a nurse is going to say that I am a caring nurse. What are the various things which should be present in that caring relationship? So we are going to look into the each and every aspects of this theory. But before that, first let us look into an introduction about the theorist. So her name is Jean Watson, and she was born in West Virginia in US. And in 1964, she completed her BS, that is her undergraduate program from University of Colorado. In 1966, she completed her master's in psychiatric, that is mental health nursing, again from University of Colorado. In 1973, she attained her PhD, especially in educational psychology and counseling, again from the same university. And she has worked as a distinguished professor of nursing and chair in caring science at the University of Colorado Health Sciences Center. She is also a fellow of the American Academy of Nursing. She has been the Dean of Nursing at the University Health Sciences Center and the President of National League for Nursing. No wonder she has received 6 honorary doctoral degrees for her wonderful work on this particular theory. And she has main area of research topic has been in human caring and loss. And in 1988, her theory was published in Nursing, Human Science and Human Care. So we find a living legend, okay, that is Jean Watson, who has done so many contributions related to her paper on theory. And I think this is one of the best theories we can say that we have in nursing related to a humanistic perspective. That is, it is not talking about doing some input and gaining some output, nothing like that. It is about taking care of a person from a humanistic perspective, to look people in what to say, not only from a technological era, but from a humanistic perspective. That is the beauty of this theory, that is Watson's theory of caring. So let us look into what is the definition of nursing according to Jean Watson. According to Watson, nursing is a human science. It is a human science of two things. It is a human science of persons. It is a human science of health illness experiences, which are mediated by professional transactions, personal transactions, scientific, aesthetic, and ethical human care transactions. See, it is a beautiful definition which says that nursing is a science. It is a human science. So this science is going to take care of two things. One is you're going to take care of persons. Persons is our client, it can be our patient. So it is a science of taking care of persons. In addition, she said that it is a science of human health illness experiences. That is, what are the experiences we are going to give when a person is going to have that, thing of health and illness. Okay, that health illness experiences, during that health illness experiences, how to take care of these patients. That is a science. And that is what Watson said. It is a human science of persons. It is a human science of experiences, health, illness experiences. And what is mediating all these things? It is mediated by a lot of transactions. What are these transactions? Number one, it is professional transaction. Definitely, it is a professional transaction between a nurse and a patient. But it is also a personal transaction. In addition, it is scientific. At the same time, it is aesthetic. It is aesthetic transaction along with it a beautiful word, ethical. It is ethical human care transaction. So we understand from this definition the importance that Watson has given it for the sake of humanism, humanistic care, to take care of persons, to take care of their experiences, having all sorts of transactions. Let it be starting from professional till ethical transaction. Now, what are the elements of this caring theory? I can say you that if these three elements are being studied by students, you can write beautifully what is Watson's theory of caring. So let us see what they are. Totally, there are three elements. Number one, she believed the first element of her theory is character factors, which is evolving into caritas factors. Okay, so character or caritas factors is there. That is her first element. The second element is there should be a transpersonal caring relationship. The second thing what she said is it is not only enough if I'm going to have some elements of factors with me, but there should be a relationship. That is transpersonal caring relationship. And number three is a beautiful one. Caring occasion or caring moment should be there. So I will discuss in detail about these three elements. So to tell it again, number one is character factors should be there. Character factors are slowly evolving into caritas factors. Number two is it's not enough if I have the factors with me, there should be a relationship. What type of relationship should be? It should be a transpersonal relationship. It should be a transpersonal caring relationship. And what is number three? Caring occasion or caring moment. Now, what we are going to do in this video is the three things we are going to explore in detail. And that completes the main elements of Watson's theory. So let us see what is number one, caritas factors. What do you mean by the word caritas? Watson says caritas has a greater spiritual dimension, which means that it is not only professional, it is not only personal, it is not only ethical, but it has a bit of spiritual touch. Okay, there is a spiritual dimension. And she says in Greek, the meaning of the word caritas is to cherish, to give special attention, to give special loving attention. That is the meaning of the word caritas. So we understand from this slide that this transaction, what I'm going to have with my patient, is not only scientific, there is a bit of spiritual dimension, there is a bit of special loving attention which is being given to the patients, to cherish the patient and then to give special loving attention. Now, what are the various factors which comes under caritas factors or caritas process? So Watson said that 10 character factors are there. What do I mean by that? Like, if I'm going to say that I am really caring, I am a very caring person, what will Watson look into? Watson will look whether these 10 elements are there within me for me to say that I am a caring person. Because according to Watson, if you are a caring nurse, you will have these 10 character factors. I hope it is clear. So if these 10 factors are there within me, automatically me, that is this nurse, is going to become a very caring nurse. So what are the 10 elements of caring? Number one, what is the first element? It is to form a humanistic, altruistic system of values. Okay, which means this nurse or this person who is going to give care to the patient should have some altruistic system of values. We all know what is altruism. Altruism is when selflessly you're going to give to others. That is altruism. That is altruistic practice. So this nurse should be having some system of values. What system of values? Altruistic system of values. And she said that this nurse should have a practice loving kindness. There should be equanimity within the context of caring consciousness. Only when I am going to practice that loving kind way to my patient, I can say that I have these values. See, only when I have certain values, it will be reflected in my practice. A person with values, a person with positive values, a person with good values will reflect that in the behavior, will reflect that in the practice, right? Same way, what Watson is telling us, Watson reminds us that a nurse who is going to take care of a patient, who is going to enter into a transpersonal caring relationship, should have certain values, altruistic system of values to practice loving kindness. I hope you got it. Number two, what is the second character factor? In order to be a caring person, we have to instill faith, we have to instill hope to another person. That is, to be authentically present, to sustain the deep belief system and the subjective life world of self and one being cared for. See, we say that mothers are very caring. Is it not? Why? We say mothers are caring because we know that they always give that loving kindness to their children. We always provide faith We give hope to our children. We don't shatter their hopes. We try to instill the faith. We try to say, yes, you can. My child, you can do it. Or we try to instill that hope within the child. That is in simple what is caring. So what Watson is telling us, when we as nurses, when we are going to practice caring to the patient, if that values are there, if you are really a caring person, we will instill that faith to the patient. We will instill that hope to the patient. It is not false hopes. It is a real hope. It is a real faith which I am going to instill to the patient. So the explanation is, what should a nurse do in order to instill faith and hope? We should be authentically present with the patient during that relationship. I should not be in a hurry. I should be available to my patient in order to listen to what are his feelings, and my patient slowly will start to understand that this particular nurse is caring because this person is having faith within the nurse. Okay, so it is reciprocal, where how to establish that faith and hope within the patient is to be authentically present to the patient, and then to enable that belief system, to sustain that belief system. I must be having faith in the patient that this person is going to improve. Maybe it is not only medically. This healing is not always medical. Healing can take place even when an illness is present. So that is how Watson climbs to this particular point of faith and hope. Instilling that faith, instilling the hope to the patient. So number one is having values. Number two is to sustain that faith, to sustain the hope in a patient. Installation of faith and hope. Number three, cultivation of sensitivity to self and sensitivity to others. See, only when I am sensitive to my needs, I will be able to be sensitive to others. If I am not going to be sensitive to my own needs, only a person who has some love and affection inside can show that love and affection to others. That is, your cup should be full. Only when this cup is full, I can provide something to others. When this cup is going to be empty, I cannot provide anything to anybody, right? So same way, first of all, what Watson says is, if you want to be a caring nurse, make sure that you're sensitive to self, and that sensitivity elements should be practiced with others. So it is by cultivating one's own spiritual practice, it is by understanding one's own self, and then going beyond the ego self. So what is that ego self is? When we are going to be sensitive to others, sometimes there is something called as ego which is blocking us. Say for example, now, as a nurse, I may have my own job description. I need not do certain other things. But when there is a particular need in the patient's environment, I don't mind doing the other thing also, though it is not my job description. I may not wait for an LPN. I may not wait for a nursing assistant. I may not wait for a carer to come and clean the, say, for example, the bed linen of the patient. If it is needed, though I am an RN, though I am a ward in charge, though I am a nurse manager, though I am a nursing superintendent of the hospital, when I see there is a need for a particular patient, I don't mind going beyond my objective self. That is the meaning of the word being sensitive to others. That is, what is blocking us from doing certain things is our ego. Like, for example, I may think I'm a nurse manager. Why should I do this particular thing? The patient may be suffering, but I can think like, let the nurse X come and do that. But if I am really a nurse who is very caring, in spite of being a manager, in spite of being a nursing officer, that particular thing will come like, okay, let me do it for the patient. At least his struggle will get reduced for 5 minutes extra, right? So when I start to practice that, that is the essence of caring, where you become sensitive to the needs of others. That's why I say this is a beautiful theory, because this theory is exploring in detail what exactly is caring. What exactly is caring? Three factors we studied. Number one is you should have some system of values. altruism. Number two is we should be persons who are instilling faith, who are instilling hope to another patient. Number three, to be sensitive to self, to be sensitive to the need of others. Coming on to character factor number four, to develop a helping and a trusting relationship. What is helping in a trusting relationship? It is very straightforward. You're going to help your patients, you're going to develop the trustworthiness in that caring relationship. So, authentic caring relationship. It is not only in words, but it is in action. It is not only in telling sweet words or telling kind words to the patient, but it is doing things which are necessary for the patient. That is when a patient starts to develop trust within us. So with us. Okay, so Watson believed that one important factor which is essential for a caring relationship is ability to develop a helping relationship and a trusting relationship. Number five, promotion and acceptance of expression of positive and negative feelings. That is, we know that like this is a very straightforward point again, which says that we should be persons who are able to accept, who are able to helping the patient to ventilate not only his positive feelings but also negative feelings. Okay, when we think about our own life, when we think about our own friends, very close friends whom we have, what is the difference between a very superficial friend and a genuine friend? A superficial friend will only know or knows only about our positive points, whereas a genuine friend of ours, a close friend of mine, will know everything about me, and in spite of that, she has accepted me as her friend, or he has accepted me as his friend. Okay, that is when we say that she is my friend because I know that she cares for me, right? So same way a patient should be able to establish that relationship with the nurse only when he knows that she is able to accept not only my positive feelings but also my negative feelings. So being present, being supportive, trying to express that negative and positive feelings, and trying to have a connection with the deeper spirit of self and the one being cared for. So especially in a medical or in our profession, we come across patients with who are having history which are of good type as well as which are of not so good type. But that hearing that history should not make you to judge the patient who is going to sit in front of you in order to receive the care. That is what Watson says. A nurse, a caring nurse, will be a patient who is able to promote, who is able to accept not only the positive feelings expressed, but also the negative feelings which are being expressed. So if you are a person who can promote and accept all those things, you are definitely a caring nurse. Number six, systematic use of problem solving method, scientific problem solving method for decision making. So what I appreciate in Watson is it is not only being kind, it is not only having values, it is not only faith, it is not only hope, but you should be good. Scientific knowledge should be there. You should have a very good scientific problem solving method, systematically using scientific problem solving method for decision making. So caring process is not only being very good and trying to instill faith, but this nurse should be scientifically good. She should be a good problem solver in order to help the patient to make the decision. So that is another important factor. That is the sixth character factor. Number seven, promotion of transpersonal teaching and learning. So if you are really a very caring nurse, you will involve the patient because you want to help your patient. You want to help your patient in learning the most important things. Maybe it is related to condition, it is maybe related to how to cope up with a particular situation. So you will involve, or you will involve yourself in transpersonal teaching and learning. What do you mean by transpersonal teaching? It is engaging in genuine teaching learning experience which attends to the unity of being, meaning, attempting to stay within others' frame of reference. Transpersonal teaching is not like ordinary teaching learning. It is not like you teach a patient about, say, coronary angiogram or say CABG surgery. You're just teaching and going. No, you are trying to involve yourself with the patient. learning to really think whether this patient will be able to understand the terminologies which I am going to speak to the patient. Is the patient capable of receiving so much information with one sitting, or maybe should I divide this into two or three? Maybe the patient is already troubled with so many family issues. Now if I am going to take a lot of teaching thing, maybe the patient will not be able to have that concentration, so let me break it into two or three sittings. So, genuine teaching learning, where you really are giving importance not only to the knowledge, but you're giving importance to the unity of being authentically, and then you're trying to conduct this teaching learning experience. So, a caring nurse will involve herself in transpersonal teaching learning experience. Number 8, provision for supportive, protective, and corrective, mental, physical, sociocultural, and spiritual environment. How beautiful words Watson has put there. She said that a nurse should be able to provide not only a supportive environment, but a protective environment, even a corrective environment. Corrections, not only physically, but mentally, socioculturally, and spiritually. I think she has covered all the aspects. It is not only in one environment, it is not only physical, it is not only social, it is not only mental, but also spiritual environment. It is not only supportive environment, but you have to provide a protective environment. You should be able to provide a corrective environment. So it is like, in nutshell, we can say that it is a healing environment in all levels. Okay, whereby the wholeness, beauty, comfort, dignity, and peace are potentiated. So, which means that though these words appear so big, though these words appear so wow, how can I do this level, that level, this level? It's very simple. If you have a very good system of values, if you have that real love and affection and faith and hope to instill in your patient, all these things will come together. I always remember being a mother and being a carer. Okay, when you are a mother, nobody has to teach you that you should take care of the physical aspect of your child, your social aspect of the child, spiritual aspect of the child, because you are genuinely involved in helping the child to grow up. So automatically there is no need for anyone to come and tell you, look into the physical, look into the mental, look into the social, look into the cultural, look into the spiritual. No, when you are really involved in a particular caring relationship, everything will flow into it. There will be protective actions, there will be supportive actions, there will be corrective actions where it is necessary. So it is such a beautiful point. A nurse who is genuinely involved in a transpersonal caring relationship will provide these environment for the patients. Number 9, assistance with gratification of human needs while preserving human dignity and wholeness. So we all know that one important function of the nurse is we have to meet the need of the patients. It can be physical need, it can be psychological need, it can be social need, spiritual need, and so on. But what Watson is reminding us is, when you are trying to gratify that particular needs, make sure that you are providing it with good human dignity. Preserve the dignity of the patient, preserve the wholeness of the patient. Don't give a very fragmented care just because a patient is unconscious, just because a patient is on support of mechanical ventilator, doesn't mean that this person is a case of something. This person is a human being with his own dignity, with his own wholeness, and with his own needs. So, when I try to provide care to a patient, I should learn to preserve the dignity of the patient in its own wholeness while I am trying to meet the need of the patient. So, the Watson reminds that we have to recognize all the needs of the patients and the self, and try to meet the lower order needs before meeting the in order to attain the higher order needs. I remember Maslow's hierarchy, where Maslow beautifully tells us that First, the basic needs should be met, and only then the other needs are met. The same way, whatever is the basic needs, that has to be met first. Once that pain is reduced, once comfort level is there, once a very good sleep is there, once a patient starts to take good food, automatically healing will start to take place. The patient's mentally, psychologically, the patient will start to feel better, and the patient's wholeness and the dignity can be preserved. So, gratifying the needs of the patient, but by preserving dignity and wholeness. The last one is such a beautiful point. It is allowance for and being open to existential. I don't know how many of you can appreciate this point, because it talks about phenomenological dimensions. It talks about spiritual dimensions. When you are trying to be the mother of a child, or when you're going to be a parent of a particular child, okay, when a child is having, say, sickness or something like that, or when, say, some small injury or some sickness, we always do the best possible thing, whatever is possible by us. We provide the best thing. And then there are certain things which cannot be completely changed. Maybe it is due to some sickness which is there in the child. Maybe it is a medical diagnosis. But we find parents, we find not only parents, we find many people who believe in the spiritual dimension, who leave it to something open to existential, where you say that, okay, you do whatever is possible, you do for the patient, and then you believe, maybe if it is spiritual, because Watson gives importance to spiritual dimension, I believe that she would have given importance to that spirituality, where she is believing that certain things, I want you to go through that point here, certain caring and healing dimensions cannot be fully explained scientifically. Like, everything cannot be explained scientifically. There are certain people who, with a terminal stage of cancer, maybe it is due to spiritual healing, maybe it is due to a very wonderful family and, say, a very good spiritual support, patient feels happy to live even in that terminal stage of cancer. You cannot explain it scientifically using that these are the stages of grieving. No, that is not applicable to that particular patient. We find certain patients are healed miraculously. I know, like, I've heard about people who had a lump in the breast, who was said a biopsy should be taken, and when the patient went for a biopsy, the lump is not there. The lump has been disappeared. How do you talk about it scientifically? There are certain things which cannot be explained scientifically. And so, what is that? So, allow for that and being open to existential. I think that is the pinnacle of a nurse who is really a caring nurse, where you pray for the patient, where you believe that certain things is going to happen for the patient, which cannot be explained scientifically. It's talking about the last point here, caring of the soul, taking care of one's own soul and taking care of the soul of the person whom you are going to care for. So these are the 10 beautiful character factors which has been listed by Jean Watson. Okay, so it is such a wonderful point where each and every point is telling us that yes, this is an element of caring. So these are the 10 factors which is being given by Jean Watson. Let us look into it just to tell the keywords. Number one is there should be a humanistic system of values. What values? Altruism should be there to give something to others. Number two, a nurse should have the power of instilling faith, instilling hope to the patient by being authentically present with the patient. Number three, to be sensitive to self, to be sensitive to others, to go beyond the ego self, to go beyond that objective self in order to help the patient. Number four, to develop a helping and a trusting relationship. Number five, allow the patient to promote, allow the patient to express, and encourage the patient to express not only positive but also negative feelings. Use scientific problem solving for decision making. So, a nurse, according to Watson, is not only psychologically taking care of the patient, but she should be a very good scientific problem solver. Number seven, promote genuine teaching, learning experience with the patient so that you remain within the frame of reference of the patient. Number 8, providing all sorts of care, support, uh, protective, corrective in all dimensions. That is a healing environment in all dimensions. Gratification of needs, but by preserving dignity of the patient. Lower order needs are met first, then higher order needs are met. What is the last one? Allowance, being open to existential, which cannot be explained scientifically. Phenomenology, lived experience, taking care of one's soul, taking care of the soul of the person whom we are caring. I hope you loved this 10 character factors, which is being given by Jane Watson. I think again I'm telling you there is no other theory which talks so beautifully about what are the elements to say that these are the character factors. So that's a really appreciation to Gene Watson for this beautiful character factors. Number 2. So that is about the first element. So we have covered only the first element, character factors. Number 2. The second element in Watson's theory is transpersonal caring relationship. I told you, say for example, I have all these factors. It's not enough. I should enter into a caring relationship. So that is the second element of Watson's theory. What do you mean by transpersonal caring relationship? To go beyond one's ego and to have a spiritual connection while comforting a patient. As I told you, we all have certain objective roles. We may always think that why should I do that? This is enough. This is what is being told to me. I will do only that. But going beyond one's ego self, trying to connect with the soul of another person, and then trying to give care to that patient is transpersonal caring relationship. So it depends on three things. What are they? If you want to enter into a transpersonal caring relationship, you should have these three things. What are they? Number 1, you should have a commitment. I should have a commitment from the nurse. What commitment? To promote and enhance human dignity. So I should have a commitment to the person whom I am going to give care, to make sure that his dignity is preserved. Commitment from the nurse. Number 2, an awareness that I have the ability to heal. How many of us, when we are working as nurses, we have this awareness that I can make a change in my patient? How many of us work like that? That is Watson's theory, which says that a nurse should have commitment, a nurse should have an awareness that I have the ability to heal this person who is sitting in front of me. Number 3, and willing to go beyond the objective role. If you can do this, you can enter into a very caring relationship. What is it? Number 1, commitment. What is number 2? Awareness that I have the ability to heal. What is number 3? Willingness to go beyond the objective role and taking care of the patients. So what is the goal of transpersonal relationship? The goal of transpersonal relationship is 3. Number 1, as we studied just now, to preserve the human dignity. Number 2, it's not only dignity, but you're making sure that you're preserving a patient's spirit. You're making sure that when I give this care to the patient, my patient doesn't feel that I am an object for everyone to come and do the examination. I am an object. No, you should. The goal of transpersonal relationship is that you're preserving the patient's spirit so that the patient feels that I am a human being who is taken care of and that I am not the object. Number 3, allowing the nurse and the patient to seek out meaning, and in turn thereby there is a transcendence of suffering. So there should be a meaning in this caring relationship and the patient's suffering should reduce. There should be a transcendence of suffering when a nurse enters into a transpersonal caring relationship. So let me tell you again, there are three elements. The first element is the 10 character factors. The second element is transpersonal relationship, going beyond one's ego self, entering and having a connection with the spirit of another person, having a commitment, realizing that I have the ability to heal and willingness to go beyond my ego self. The goal is preserve the human dignity, preserve the human spirit, and try to reduce the suffering of the patient whom you are caring. The third one, the most beautiful in this theory is this one, caring occasion or caring moment. See, Watson stated that when human caring is created, the nurse and the patient comes together to create a moment which is known as caring occasion or caring moment. To make it more clear, Watson said that though the nurse the patient must be aware of the caring moment so that you can make use of appropriate choices and actions, and thereby the nurse, without knowing, becomes a part of patient's life history. See, it's such a beautiful, beautiful concept which is there in Watson's theory. I'll tell you what is it. Caring occasion. See, like for example, when we join as students in a particular college, okay, we may have so many colleagues or so many peer groups will be there. Say around 20 students are there in the class, but you say hi to everyone. But you will find that after, say, within 2 or 3 months, maybe 2 or 3 people will be your close friends. Okay, compared to the rest 27 or 26, you have 3 people whom you identify as your friends. Why? Because there were certain caring moments in every relationship. There are certain moments which are called as caring moments. What is caring moment? It is after that particular moment I feel that yes, she is my friend. Yes, this nurse is really good. Yes, this doctor is really wonderful. Why? Because there was a caring moment. When you look back, when you think back, you will understand that in our relationship, in all our relationship, that caring moment is there. Maybe it was the nurse who was doing a particular procedure, but something happened, but she was to leave the ward. She was to leave her duty is getting over by 7 p.m. And you know that every day these nurses, they give their hand over and take over at say 7 p.m. So only the next nurse, when she is coming to the job, she will be doing this particular thing. Say for example, there was a small problem of a patient. The patient is complaining. Maybe the patient is complaining, or the bystander is coming and telling that can you please give feed of something to the patient. And you have two choices over there. One is your duty time is over. You can kindly tell her that I understand he needs some water, but now my work time is over, so I'm just leaving. The next nurse, she will come and she will give it within 10 minutes. Maybe it may take half an hour, but you say it is within 10 minutes and you smile and you leave the ward. The second option is, you know that it is 7 or 7:05, but there is a patient who is in need of water, and the bystander is not so confident to give water to that particular patient, maybe due to some oral surgeries. Now, you are a professional nurse and you have to leave, but you understand the importance of that particular moment. So, this nurse, in spite of being late, she goes to the patient. She gives that feeding. She is giving that feeding to that particular patient, and maybe it is late for her by 15 minutes, but still with a smile on her face, she's saying, now I hope everything is okay. I hope you're comfortable. Shall I leave? And she leaves the clinicals that particular day. The next day, when this patient or bystander sees this particular nurse, there is a special bond which has developed between this nurse and the patient because of that caring moment. There are a lot of caring moments which are there in all of our relationships. That caring moment is there in a nurse patient relationship. Only when that caring moment strikes positively, the patient will feel a very good relationship with the nurse, and the nurse also will find a very good relationship with the patient. And that is transpersonal caring relationship. So, what is Watson telling us? Watson says that we should be aware of that caring moment and make appropriate choices and decisions so that the nurse, even without knowing, becomes a part of a patient's life history. Isn't that beautiful? So there are a lot of caring moments. So next time when you go and give care to the patient, utilize that caring moments, because that caring moments will make you to become, even without you knowing, you would have become a part of the patient's life history. The patient will remember you as a very caring nurse. I hope it is clear. So these are the three elements. I hope students, for exam, it's very easy to write. You have to just study the 10 character factors. Number two, you will have to study about the caring relationship. transpersonal caring relationship, and number three is utilization of caring moments. That's all. Theory is over. Now we are moving on to the assumptions given by Watson's theory. Number one, Watson believed that moral commitment, intentionality, and when there is caritas consciousness in the nurse, it will protect. When you have moral commitment, it will protect the human dignity. It will enhance and potentiate the human dignity, wholeness, and healing. I do agree with that point because whenever there is a commitment from the nurse, especially moral commitment, you will preserve the dignity and the wholeness of the patient. Number two, the nurse seeks to recognize, accurately detect, connect with the inner spirit of another person through genuine presence and being centered in the caring moment. So it is not only giving bodily care to the patient, it is not only taking care of the physical needs of the patient. Watson believes that the nurse has to recognize and connect with the spirit of the patient in order to promote that caring moment and healing. Number three, the nurse's ability to connect is translated. How do you show your ability to connect with the spirit of the patient? Through your movements, through our gestures, through our facial expressions, procedures, information, touch, sound, verbal expressions. There are lots of ways how we can show ourselves as caring to others. Nobody has to teach us. It is because we all are good human beings who have the ability to take care of each other. It may be through our gestures, it may be through the information, it may be through the specific procedure we do at the specific time, which shows that we are really caring for the particular patient through your facial expressions, verbal expressions, and so on. Ongoing personal development, professional development, and spiritual growth will help a patient to enter into a deeper level of professional healing practice. So, Watson said that if you are a nurse who is trying to develop personally, professionally, and spiritually, then you will be able to give a very higher level of healing practice to the patient. So these are the four assumptions according to Watson's theory. Very simple assumptions. If you are morally committed, you can enhance the dignity of the patient. Number two, don't connect just physically or meet the needs of the patient. Try to connect with the spirit of the patient. Show that. How do you show that? It can be through gestures, body movements, etc., etc. Number four, you have to develop yourself personally, professionally, and you will have to have that spiritual growth so that you're going to practice a deeper level of healing, professional healing practice. Three propositions for Watson. Number one, nursing care is physical. Nursing care can be physical. Nursing care can be and is physical, procedural, objective, and factual. So she said that according to Watson, the proposition is nursing care. How do we give nursing care? By physically, procedurally, objectively, factually. Number two, a person's body is confined to time and space, but the mind and soul are not confined to physical universe. I hope this is a statement which we all will agree. Okay, my body and mind, my body can be present here, but my mind and soul can be elsewhere. Okay, so Watson reminds us that it is not only important to take care of the bodily needs of the patient, but you have to take care of the soul of the patient. Person needs one another in caring, loving way. Love and caring are two universal givens. So she believed that we all need each other. What to say, especially to caring persons, loving persons. We always treasure people who care us, people who love us. The same thing can happen in a nurse-patient relationship. When you are genuinely interested in the healing of the patient, you are not only going to meet the needs of the patient's physical needs, but you will be able to heal the patient completely. So the three propositions to remember according to Watson, nursing care is not only psychological, it is physical. Number two, but that physical is not confined to time and space. Okay, it is confined, but the spirit is not confined. The soul is not confined. And we all need each other to take care of each other. We need love and care. Now coming on to the meta paradigm. Okay, meta paradigm, we know four meta paradigms are there. It is very easy. You can write it by yourself once you have understood the theory, because she believed a human being is a unity of mind, body, spirit, nature. She said a human being is an embodied spirit. Embodied means it's not only body, it is mind, body, spirit, and nature. Okay, so it is subjective and unique. It is not objective, it is not predictable, it is not calculating. That is how Watson's theory differs from others' theory. Like even Parsi's theory of human becoming. Parsi also gives importance to this word. That is, Parsi talks about being that the patient is subjective. Yeah, every person is unique. Okay, you cannot predict. It is not predictable. This theory cannot be just because it worked for one patient. It need not work for another patient. Okay, because every human being is subjective and unique. It is not objective or predictable. She believed every person has their own human needs, distinct human needs, biophysical, psychophysical, psychosocial, interpersonal. Human beings are to be valued, they are to be cared, they are to be respected, they are to be nurtured, they are to be understood and assisted. So we understand that human being is placed on a higher pedestal. This person, the patient whom I'm going to take care, is not only a to meet the physical needs of the patient. This person is an embodied spirit. This person has his own needs. This person has his own distinct needs. And just because it worked for one patient, it need not work for this patient, because people are subjective. It is not predictable. These people are not objective. They have to be valued, they have to be respected, they have to be nurtured, they have to be cared, they have to be understood, and so on. Next is environment. What is environment according to Watson? She believed a very good environment is needed for healing. What is that healing? What environment is needed? Mental environment, good physical, social, emotional, spiritual, developmental, protective, supportive. So all environments in a very good way, only when it is there, the person will start to heal. And recently she added one more environment, which is called as non-physical energetic environment, where a vibrational feel integral with the person, where the nurse is not only the environment, not only in the environment, but the nurse is the environment. So I remember Roger's theory, where Roger also talks about energy fields. Same way Watson has added a new element to this environment, that is energetic environment. It is a non-physical, it cannot be seen, but there is a lot of vibrations which are taking place between the patient and the nurse. It's actually like an energy field. Okay, so that is, so she believed that nurse is not in the environment, but the nurse is the environment. So we understand the importance of environment in Watson's theory, where she believed that a very good environment in all levels is necessary for healing. Number three, unity and harmony within the body, mind, and soul is health. So it is not only harmony within the body, it is harmony within the body, the mind, and the soul. A harmony between self, a harmony between others, between self, between nature. All those things are essential to say that a person is healthy, according to Watson. She believed illness is not necessarily a disease, but it is a subjective disharmony within the spheres of a patient. So, what she believes is, when will Watson say that a person is healthy? Even if I'm physically healthy, if psychologically, if I'm not feeling good, if spiritually I have, say, some spiritual distress, socially I am experiencing social isolation, Watson will say that I am not healthy. Because for Watson to say that you are healthy, what should be there? There should be harmony between the body, mind, and spirit. There should be harmony within self. There should be harmony with others. There should be harmony with nature. Only then Watson will say that this person is healthy. So just because a patient is having an illness doesn't mean that he is having disease. Okay, even a sick person, if he is able to maintain that harmony within self, within others, with nature, Watson will say that this person is having a healthy life. Okay, so that is according to Watson, health. And the last one is, what is nursing? Now, this is only one sentence without a full stop. Okay, at the end, you have a full stop. It's just a single sentence where all the three elements are being put. You remember what are the three elements? Caritas factors, transpersonal caring relationship, caring moment. Put these three things in this sentence, you will get the definition of nursing. Nursing is reciprocal transpersonal relationship in caring moments which are guided by character factors and caritas process. How beautiful. It is a caring relationship with caring moments, and it is guided by, how am I guide, what is guiding this caring relationship? Caritas factors and caritas, character factors and caritas process. So that is the definition of nursing. So you can write more than this. You can say about the What are all the factors that are essential for a nurse to end up into this meta paradigm of nursing. So this can be written by yourself. Just remember the keywords. Who is a patient? A patient is an embodied spirit, which means body, mind, spirit. Subjective, not predictable, not objective. Okay, has his own distinct needs, should be respected, should be cared, should be understood, should be nurtured, etc. Number two, environment. Very, very important according to Watson. All levels of environment should be perfect so that there is healing within the patient. In addition, she said, nurse is not in the environment, nurse is the environment. Number three, what is health? Health is when you're having harmony and unity within body, mind, spirit, between self, between others, between self, between nature, you are considered to be healthy. What is nursing? Beautiful. Entering into a caring relationship with a lot of caring moments which are guided by caritas and Curative factors. Now coming on to whether Watson's theory is theory. No doubt it is a theory. It is logical in nature. It is simple. It is relatively simple. It is generalizable. A lot of qualitative studies have been done based on this particular theory. If you're going to take Roy's theory, Orum's theory, if you're going to take Betty Newman's theory, yes, quantitative and qualitative, Levin's theory, all those things you find more quantitative studies are done. But Watson's theory, you will find a lot of phenomenological studies are being done based on this caring theory. This theory can be used to guide and improve practice. It is supported by numerous other theories and works of humanists, philosophers, developmentalists, and psychologists. What is the strength of Watson's theory? Strength of Watson's theory is Watson has placed this patient beautifully in the context of family, community, culture. Everywhere she is talking about socio-cultural, spiritual, psychological, okay, self and others. So the human, this person is not considered as an object. He is placed in the context of all these things. And she believed that the patient or the human being is the focus of practice. It is not technology. It is not how good you are able to connect everything and start a patient on a ventilator, or how good you are in to do a particular dressing, technically how good you are. No, it gives more than that. It is the focus of practice is the patient. So I want this person to be respected. I want this person to preserve his dignity. I want his needs to be met. I want my person to have that hope and faith. It is a higher level. So humans are kept in the context of family. Humans are the focus of practice. It is not only the technology. What is the limitation of Watson's theory? Critics says that most of the needs, like if you're going to see the 10 character factors, most of the needs are psychological and biophysical needs are given less importance. That is one critic. Number two, again, psychosocial needs are being told more, and not much research is being done based on Watson's theory because not much quantitative studies. Mainly we have phenomenological and qualitative studies are there. So more research is needed to apply this theory in practice. Coming on to how to apply Watson's theory in a care plan. Okay, the first step is assessment. Assessment is the nurse and the patient are coming together. The nurse will observe, the nurse will identify, the nurse will review the problem, and then it's just like a simple nursing care plan where you enter into the patient's thing, you try to identify what are the problems of the patient, and then you follow you are gathering all the assessment data and you're going to start with planning. Planning is where you're going to discuss the with the patient what is the goal, and because planning is essential according to Watson, because it is not only that the patient's goal is being met, even the nurse is growing, okay, by doing that particular planning. So it includes discussion. And third one is intervention. Directly you are going to act and implement that particular plan. So what is going to guide the intervention of nurses? The 10 caritas factors are going to achieve. In order to achieve that goal, you have to write which caritas factors you applied and what you did in order to do that. Okay, so that will be intervention. And evaluation is whether the goals of intervention was achieved or not, and how to know that mutual reflection. Both the nurse and the patient are going to speak up and reflect whether the goals were achieved or not. Now, how to apply this nursing care plan from an exam point of view, especially for students who are studying in India, okay, who are going to write a theory based care plan. My sincere opinion is that it may be a little bit difficult to apply this theory for a short term period. Like when you are being evaluated for 3 hours of practical exam, it may be difficult for you to apply this theory. See, otherwise, a care plan is the same, except that during the intervention aspect, no, whenever you're going to do that, write that objective, it should be mutually set. Just like we studied in Roy's adaptation model, the goal should be mutually set. You're going to write it is mutually set. And in intervention, you will have to write which Caritas factors are you implementing. Say, for example, I'm going to gratification of human needs. I will be writing, okay, Caritas factor number 8. I will underline that under that intervention, and you can say what all you did for the patient. Maybe you helped the patient for a rice tube feeding. Maybe you gave a sponge for the patient. Maybe you helped the patient to what to say the meeting the elimination needs of the patient, etc. Okay, so all that is coming under that particular Caritas factor, that is gratification of needs. Sometimes it, like for example, patient is expressing fear and anxiety. Maybe I can apply two Caritas factors, like for example, instilling faith, instilling hope, entering into a helping relationship and a trusting relationship. So maybe in the intervention point, you can write Caritas factor number 2, Caritas factor number 4. Under that, what interventions you did. Whenever you write Watson's theory care plan, you should find that certain words are there. Like at least, you should know that the Caritas factors have come under that particular step of intervention. And then you're going to evaluate and see whether the person's goal has been achieved or not. Now, coming on to conclusion. To conclude, Watson's theory is a very good theory because it has really presented a lot of useful concepts for the practice of nursing, and her detailed descriptions of character factors can guide anyone who want to employ them in practice. If I want to become a caring nurse, okay, I have to really reflect on the 10 character factors. Okay, once you reflect on that, once you want to instill that within my practice, once I want to be aware that I'm going to create a difference in the patient whom I'm going to give care, definitely miracles will happen. Because this is a theory which says that caring is not only meeting and finishing and ending up to the goals. No, it is more than that. Okay, it is trying to become a part of another person's life history, even without you knowing, because you are inculcated with so many values. You have so much to give for the patient. You're able to understand the patient. You're able to nurture the patient. You're able to correct the patient. You're able to find and appreciate that caring moments. Try to connect deeper with the spirit of another person. It's something so beautiful, which is beyond scientific explanation. That was a point which she told, that certain things like the last character factor, certain things are open to existential, and everything cannot be explained scientifically. If you desire to be a nurse like that, try to inculcate Watson's theory of caring in your practice, and you will start to feel the satisfaction. You will be able to appreciate the difference in your nursing practice. So I hope this small video has helped you to gain an idea about what is Watson's theory of caring. And I sincerely pray and hope that this video is going to help you to get a clear picture on that. So thank you so much for your patience.